Dr. Mike Harlos is a palliative care specialist who has devoted his career to providing comfort and support and helping patients and their families make end-of-life decisions.
End of life is an intense time. It's a sad time, and it can be a joyous time. It's a time when a lot of decisions have to be made and a lot of communication has to be undertaken to discuss potential choices.
One of the most challenging issues in palliative care is making decisions with patients and families about how far to go in treating the various conditions that arise when someone has an advanced illness.
So if someone has advanced cancer, they're palliative, they're taking a comfort-focused approach, and then they get pneumonia, it's not uncommon that you'll hear families say, well, I understand that he's dying, but he shouldn't die of pneumonia. You can treat pneumonia. Cancer, I could understand if he dies from cancer, but not from pneumonia, and not from bleeding, and not from these complications.
Dr. Harlos stresses that palliative decisions are not life and death decisions.
I try to reconnect them with the fact that the underlying condition is not survivable. If we're involved as a palliative care service, that means that this is a non-survivable condition. I'll often say that we know that his life is on a path towards dying. We can't change that. What we're asking you to help us with is to pick the smoothest path.
Dr. Harlos observes that through compassionate discussion, most patients will choose a path of being kept comfortable through the end-of-life process, and that extensive interventions are not usually the preferred choice.
My advice for people would be to become informed about what their options are with regards to even documenting their wishes.
The Manitoba government has a downloadable document called the Healthcare Directive. This directive indicates your wishes only if you are unable to do so due to the severity of injury or illness. Scheduling an appointment with your family doctor specifically to discuss end-of-life issues for you or a loved one should be part of a proactive plan. When people hear palliative, their thoughts usually turn to the elderly or people in the later stages of battling a disease like cancer. But palliative patients can be any age. In 2009, Kristen and Mike Lucas faced every parent's nightmare when their 4-month-old daughter, Georgia, became unwell.
Once we got her in the hospital, it was so evident that she really wasn't getting better, and she was really unhappy in the hospital because there were so many strangers always coming in and out, and they were poking her.
Kristen and Mike had 2 other young daughters, and the family was facing enormous stress, with one or the other parent at home looking after the other children. Together, they knew something had to change. Kristen and Mike made the decision to request that Georgia could be released from the hospital to be allowed to come home.
Our focus is to support people where they want to be. If that's at home, then we'll do everything we can to support that person at home.
And when she did die, she died peacefully. She was in my arms. It was quiet. It wasn't scary.
They credit Dr. Mike Harlos and nurse Simone for helping them bring Georgia home to be surrounded by her family.
Just wanted to say that our family is okay because we brought her home. I don't think that we would be in the same place at all.
If you look at what are the elements of palliative care, well, there's the medical stuff, the drugs and the interventions that you can do for pain management and being aware of complications of illness. The rest, I would argue, is mostly being empathetic and vigilant for other people's needs, being somewhat mindful of, if this was me, if this were me, how would I want to be treated? In other words, be a good person. Like that all just, it sums up being a good person.
While it isn't always an easy road to be a palliative specialist, Dr. Harlos finds it rewarding.
I think much like the beginning of life, the end of life is a very intimate and important moment and very powerful and poignant. And our involvement, it's a privilege to be there. We have to respect that privilege.